The videos we made brought nuclear emergency preparedness to life for the people in Ventura County. Using communication methods that resonate with our key stakeholders allowed us to grow support for our program and demonstrate why we needed to have a nuclear emergency plan in place. My name is Dr. Robert Levin, and I've been the health officer for Ventura County, California since 1998. My focus on radiation emergency preparedness began in the months after the 9/11 attacks. Back then, discussions on terrorism frequently revolved around anthrax and smallpox. Having worked as a pediatrician with a focus on infectious diseases, I knew about the threats and limitations of a biological release. I believed a terrorist attack might instead target critical U.S. infrastructure, such as the shipping ports along the West Coast. Because that scale of attack would require a nuclear detonation, I started to investigate how our health department could prepare for a nuclear emergency. That investigation started a multi-year journey to develop our radiation emergency preparedness program and to build relationships with our community and partners to engage them in the emergency planning process. One of those relationships was with the CDC, which was strengthened after we finished the first draft of our radiation emergency preparedness plan. That plan improved how we prepare our radiation response teams for a radiation emergency. What it needed to do better was engage the community so that they were aware of and prepared for the roles and actions they would need to perform during a radiation emergency. We needed more than just a plan. We needed a relationship with the community built on information and trust that would support the kind of public response required for a radiation emergency. To build that trust, we created the framework for a community awareness campaign and found that the CDC offered grant support to help translate our framework into a video appeal for public radiation preparedness. That funding helped us get our radiation emergency preparedness campaign off the ground, specifically by allowing us to build videos that communicate a clear need for action to our stakeholders. We tested our videos in community focus groups. Those who participated were overwhelmingly supportive of how we used video to encourage public preparedness for a nuclear emergency. It also showed us how the topic of a nuclear detonation elicited emotions ranging from curiosity to genuine fear and concern for the safety of themselves and those they care about. That was when we knew the videos would be effective at getting the public's attention and a viable method to increase our community's awareness and support for nuclear emergency preparedness. But before we could release the videos, we also needed the support of and feedback from the county CEO and our county's 5 supervisors. Their review highlighted another critical focus for our awareness campaign. How do we help parents feel confident about their child's safety if they need to shelter in place at school? To answer that question, we sought out the participation of parents, the Ventura County Schools Emergency Planner, the Superintendent of Schools, and local parent-teacher organizations. Together, we created disaster plans and messages to help educate teachers and parents about how schools would keep their kids safe and how communication would flow to provide them with timely updates. In this way, we strengthened our relationship with the school systems in Ventura County. When the time came to launch the Radiation Emergency Preparedness Campaign, we took special precautions to ensure families with school-aged children knew about it in advance. We sent information to the students' parents a few days before the campaign launch. And a few days after the videos were released, we held a press conference and a number of town hall meetings around the county. Then we set up call centers to make sure the community could get any additional questions answered quickly. By collaborating with our partners throughout the planning process, the campaign launch went smoothly. It was a success for our county and helped our community feel more confident about our emergency response plans and how they would provide safety, information, and updates during a radiation emergency. We're now focused on building and maintaining the community's interest in radiation preparedness over the long term. This includes working with partners to encourage routine radiation emergency preparedness exercises, either independently or alongside other exercise plans. We're also interested in establishing a shelter-in-place moment, which would be an annual drill to practice the get inside, stay tuned message. Similar to how we practice sheltering during an earthquake, the shelter-in-place moment would encourage the community to practice actions that would keep them safe during a radiation emergency. Throughout this process, CDC has been a resource I could turn to and a relationship that's continued to grow over time. What started as critical grant funding to help us create our awareness videos has evolved into opportunities to speak at conferences and share our approach for promoting radiation emergency preparedness planning in our county. Since I'm a strong advocate of the get inside, stay tuned message, some of the CDC resources I'm most passionate about are the videos and infographics that showcase those actions. I found that videos like CDC's and the ones we created in our campaign help to make radiation protection concepts real to the community and help with getting buy-in from community stakeholders to support preparedness efforts. My hope is that our efforts here in Ventura County not only help our community prepare for a radiation emergency, but also help other localities who are trying to do the same. Creating a preparedness plan and communication campaign was hard work, especially with few resources. But what kept us going was the positive impact it made on our relationships with our partners and the community. Seeing our community members participate in the emergency planning process and hearing them say, "Thank you, someone is actually doing something about this," just reinforces my belief that with good communication, we can help motivate our communities to prepare for a radiation emergency.